Assalamu alaikum. My name is Rashidari and today I am going to present a case study that was conducted at Totori University, Japan. The case study was diagnosis of cystic endometrial hyperplasia and hydrometra in a pet goat. Before diving into the case study, let us quickly move through the importance of diagnostic modalities. The diagnostic techniques have importance to differentiate between tumorous and non-tumorous conditions in the reproductive tract, planning of therapy and prognosis according to that, and evaluation of urogenital organs including vagina, uterus, and the ovaries, and to differentiate between septic and aseptic conditions like uh, pyometra and hydrometra in the reproductive tract. And let us meet to the animal that was actually a goat of 9-year-old suffering from an stress since the last 6 months, having a gradual abdominal distension and continuous mucosal discharge from the vagina. And when the animal was presented at the clinic, it was previously treated with PGF2 alpha, and the animal shows absence of sign for 2-3 days, and then again relapse of the condition. The to, and to di For that, to diagnose the condition, uh, the ultrasonography was first time performed, and the ultrasonography of the uterus revealed that there is the anechoic fluid in the uterus, which is indicative for hydrometra in the reproductive tract. And after that, the endoscopy of the uterus was performed, and it also clearly shows that here is the clear fluid in the uterus. Here is the clear fluid, and there are corrugations in the uterine wall. These are the corrugations. These are actually corrugations. These are the and these are actually and walls of the uterus are have been thickened. And after that, CT scan of the reproductive tract was performed from the dorsal and the sagittal view, and the CT scan is showing here is a uterus that is actually a corrugated structure, and its wall have been thickened. And here is a ovary, right ovary, which is having small follicles here. And here is the corpus luteum, large corpus luteum. And after that, here is the uterus in another view, and here is the urinary bladder. It is actually showing the corrugations and thickening of the uterus. And after the applying all these diagnostic techniques, we confirmed that the case of hydrometra, which is caused by persistency of corpus luteum, which is actually lead to the cystic endometrial hyperplasia and endometritis. And owing to this all the case, the treatment was ovariohysterectomy, as the animal was actually kept for pet purpose, not for the breeding purpose. OVH was performed, and in these images there are the steps of to perform ovariohysterectomy. And after that, the uterus was examined after OVH. The uterus has walls which are thickened and having corrugations in it, and the uterine glands have been increased in number and in size. Here is the increase of uterine. Here is the uterine gland. Here. These are all the uterine glands. And in microscopic examination, there are the cuboidal epithelial cells which are secretory, and these here are the flat epithelial cells and other inflammatory cells. Thank you so much. I hope you understand all the uh, importance of diagnostic approaches to correct diagnose the conditions in the reproductive tract. Thank you so much.